My name is Dr. Wala Elizabeth. I'm a medical doctor by profession. I'm a health system strengthening expert. I am a board member and investor at Ponea Health. I do very many things in the health sector. So I have experience in the pharmaceutical sector, with research, with advocacy, and now with global health. So happy to be here and to talk to you more about Ponea.
Good morning, everyone. My name is Wambui Mbarire. I run the Retail Trade Association of Kenya, an association that brings together all retail of Kenya, and all retail means starting from the supermarket to people in eateries to people in fashion, all make up part of the membership. I'm here to talk about the e-commerce and the impact it has had on retail over the last 1 year as we faced closures in some sectors of the retail, and a response on the response of consumers to e-commerce taking up a space that was traditionally reserved for brick and mortar.
I can go first. With the pandemic situation, I think we have seen something that no one had ever prepared for, and that is basically the global closure of many of the borders. We have seen social measures that have been put in place to reduce the spread of COVID-19. That includes people working from home, it includes people masking up, it includes people sanitizing and washing their hands. So many of these practices and measures that have been put to control the pandemic have affected the way we've done our business, the way we teach, the way we work. And I think we are in this era or this season for a long time to come, and it's about now adapting to the new normal, as we talk as it is called.
I think on the Kenyan scene, what we've seen is a moment for e-commerce. We've really had a moment for e-commerce. From the onset, retail, in terms of supermarkets, for example, was never closed. We actually had the opportunity to continue working 24 hours if we wanted to. However, everyone else needed to get home, so that did not really pan out, that the supermarkets continued being open past the curfew hours. What we've then noticed is that people woke up to the existence of e-commerce. So like a lot of the supermarkets always had an e-commerce presence, but had very little uptake of the same. So there were very few people who would, for example, buy their flour, milk, sugar online. But what we've seen with retail, that basket shot up. So I know one of the supermarket, for example, on day 2 of the curfew said they used to have maybe 1 or 2 at most transactions on their e-commerce platform. But in the first week, they hit 3,000 a day. So that what has changed is that people realize there are things that really you no longer have to go in-store to pick. Your daily fast-moving products, milk, sugar, flour, oils, because if I order a bottle of Nivea, that's all they can bring. I don't have to see, to feel, to understand that it is the Nivea I wanted. So for the things that are common use, e-commerce has really picked up. Those who didn't have a presence have gone into creating either their own presence or creating partnerships with be it Glovo, be it Jumia, starting their own systems. So as e-commerce grew, we saw the delivery sector really grow within the e-commerce sector. But I sometimes like to put a disclaimer that e-commerce is a Nairobi problem still. And the reason being that we don't have a very good address system within our country. So you can only actually deliver in certain areas. Once you go out of the urban areas and you start having to have the conversations of the Safaricom kiosk or the charcoal guy at the corner, take a left, then look for Mbwakali, as we used to say in the olden days. So it will pick up, but I know Transport Ministry says they're looking to actually create an address system across the country. So it might move out, but what we've also seen is e-commerce in a localized kind of way. We have a company called Copia Kenya. So Copia has done a very good job outside the urban areas in creating agencies So you can find a guy who runs, say, a kiosk, becoming an agent. They have tabs. You go to the kiosk guy, you order what you want, and it is delivered from Nairobi or from whichever factory right to the rural area, and then you pick it up from there. So we've seen that become a focus within the last year, and I think it can only grow much more across various sectors of the retail thing. The other thing I'll say is that there was an element of retail that if it didn't do online, if it didn't do e-commerce, and really they were going to have a zero business year. A lot of it being, especially in fashion and apparels, in spite of the fact, and this one interestingly is more of an age thing. I think the younger people have no problem buying a dress, a top, a trouser online. The older generation still has touch and feel desire. So if you were doing fashion, it was very difficult because a lot of fashion closed down. So you needed an online presence. So that again becomes a new sector that has gone online that was traditionally locally not on the e-commerce platforms.
Yeah, I think I'll speak as a consumer. So adapting to ordering things online has not been very easy because I'm the type to make a decision when I see something. So that visual and tactile nature of things has made many of us adapt towards the new normal, which is, at the touch of your finger, order this. Then speaking as a professional for the health sector, being a very laggard in terms of adapting to technology, this season of the pandemic response has really upped many of our colleagues and facilities into adapting towards the use of technology. And for us, again, in Kenya, the regulations surrounding e-health or mobile technologies around health have been slower than the innovations that are coming out. So I think it's also been a positive for the regulators because then they've needed to move faster towards finalizing many of the policies and regulations that have been left hanging a bit, and realizing that in this space we have to adapt very quickly to technology. Finally, there is also within the space of data, the data protection, the data commission that was enacted and a commissioner appointed last year. I think that has gone a very long way towards protecting data because in all these platforms you're collecting data from people, and many of us were not comfortable with sharing where we live because we don't know where that data will, who would get into that information. In terms of health records, those are highly regulated information. So it is important, and it's a very positive step for the country that we have enacted a law that is protecting all Kenyans when it comes to releasing data, and also putting standards on the people who are getting this data, what they need to do with it, how they need to protect it, where they need to store it. So this is a positive step that has come out of this pandemic response.
Who would have thought that children would attend school online as the norm? I mean, there are schools that even before did it, but who would have thought that in many places that people would have all meetings online, have all school lessons attended online. So I think people have adapted out of lack of choice also, because you aren't being given an option. As an employer, you want to be able to continue paying you, but I want to feel I'm paying you for something you've done. So how else do I adapt your working environment to facilitate you to continue working? So I think there's going to be a lot of change. There continues to be a lot of change. I know a lot of companies that have now moved into smaller spaces because they've thought we don't really need all the 20 of you in the office anymore. You can work at home, maybe facilitate now data or laptops or whatever other gadgets you need to be able to work from home. Develop new ways of managing deliverables from employees. I think there's been quite movement towards adapting, one, because of lack of choice, and two, because this we seem to, and Dr. Wala I think talked to it, we probably will be here for a while, or this might really be the new norm. So I think the adaptation has to happen and has continued to happen.